For Britain Issue 6, we determined whether or not the Labour reforms did the trick. Meeting the needs of the British people was their intent. It could be argued they were successful to a certain extent. Want was the first giant on the list. This was to ensure no one was missed. In July 1946, the government passed the National Insurance Act. It was hoped that the problem with industrial injuries would be cracked. These matters were now to be dealt with by the state. This was important as it ensured the injured wouldn't fall into poverty, which was great. In August 1946, the government passed the National Insurance Act Part 2, which covered everyone from cradle to grave and not just a select few. It is here where welfare benefits were born. From now on, government intervention would be the norm. This was important as poverty could now be a thing of the past. However, what everyone wanted to know was, would this last? Whilst the reforms introduced to tackle want did some good, there were some problems, which is understood. Benefits did not keep up with the cost of living. With the war going on, this could be forgiven. By 1948, benefits were only 19% of the average industrial wage, which in truth was not really successful at this stage. National assistance had only been decided to help a few, however the low level of benefits meant that there was quite a big queue. Next on the list is disease. The government would now help with every pain, injury or sneeze. In November 1946, the government passed the National Health Service Bill. For every person, cradle-to-grave care the government would fulfil. Doctors' visits, operations, prescriptions, eye and hearing tests were all free. The government were committed to eradicating poverty through illness. It was clear to see. There is no doubt that these measures were a great success, as in their thousands free healthcare people did come to access. Unfortunately, this success did not last for too long, as the demand for the services was far too strong. The government had to introduce charges for dentists and opticians. Thankfully, there was no charge introduced for physicians. By 1950, the NHS was already a huge burden on the economy. For those in the know, it was clear to see. The next giant to be tackled was idleness. Not too big a problem, as the Blitz had left the country in quite a mess. Full employment was Labour's key aim. However, thanks to the war, the workforce was not the same. As a result of war casualties, there was enough jobs for all, leaving unemployment at 2.5%, which is really quite small. Industries were also nationalised to help stimulate the economy, which had a positive impact for all to see. However, one could argue that full employment was not a success for Labour, but it was definitely a success that they would want to savour. The fourth giant to be tackled was education, where Labour aimed to destroy the ignorance of the nation. In 1944, the government passed the Butler Education Act. Raising the school leaving age to 15 was their tact. The three-tier schooling system was also introduced with the hope that problems with literacy would be reduced. Attendance at school also became compulsory at this time, along with free milk and food at lunchtime. The intention from the Labour government was definitely good. They really hoped everyone could succeed, even those from the hood. However, the new school system made the gap between the rich and poor even worse, as the system with grammar schools became a curse. The well-off could afford tutors to pass the 11+, with the poor having no means to make a fuss. Labour did little for working-class children who left school at 15. With very little prospect, the lack of impact was clear to be seen. The final giant to be tackled was squalor. In terms of housing, the government wanted the problem to be smaller. 700,000 houses were destroyed by the Blitz, and 1/3 of houses were in need of repair. The government felt committing to house building was only fair. They promised to build 200,000 homes per year. Would they have enough materials was their biggest fear. Between 1945 and 1951, 4 council houses were built for every private one, which could be considered a success according to some. The New Towns Act of 1946 also laid the plans for 14 new towns, where new developments would be created on impressive grounds. However, Labour did not build as many houses as promised, which was a real disappointment. Let's be honest. Poor housing and homelessness were still serious problems by 1951, which is why Labour lost the 1951 election to the Conservatives, according to some. So now we must decide if the Labour government were successful with their intent. I think we can all agree they met the needs of the British people to a certain extent. Each giant tackled had some levels of success, some groups more than others though, we must stress. Want had some success but was not the most successful one. The introduction of welfare benefits were a real improvement according to some. No longer would people fall into poverty, thus leading to some success, as you can see. The least successful giant was squalor, there is no doubt. In terms of building new houses, there clearly was a drought. In terms of housing, Labour were full of good intentions, but we can clearly see they were not successful with their housing intentions. A lack of manpower and resources was to blame. Well, that's what the Labour government tried to claim. The most successful giant of them all was disease, as universal healthcare for all from cradle to grave was sure to please. This giant met the needs of every person across the land. Free treatment, opticians and prescriptions was just grand. So overall it is clear that the Labour government were successful with their intent. Their reforms of 1945 to 1951 met the needs of the British people to a certain extent.